Hi there. Welcome to Learning Objectives. My name is Richard Pierce. It's my pleasure to be with you here today. So objectives. What we want to do in this presentation is define what an objective is, to identify the components of an objective, identify the cognitive level of objectives, understand how and when to author learning objectives. We also want to generate a hypothesis for the relationship of learning objectives to assessment and evaluation. What exactly is a learning objective? A learning objective describes the intended result of instruction. It's a best practice to always phrase your learning objectives in the learner will be able to. Evaluation or assessment is the judgment by the instructor about whether the instruction has met the intended learning outcomes or objectives. So that's the relationship. The relationship's an iterative process. The instructor wants to determine what the learning objectives are, state them in learner will be able to terms, do some activity, lecture, lab, and then assess, was the learner able to, or were the learners able to achieve the objectives. The components of a learning objective are often stated as the ABCDs. The audience, behavior, condition, and degree. Now, different settings place different emphasis on these four different components. And we know who the audience is, so typically this is not a big concern. Pharmacy students or co-workers in a healthcare setting. There's typically not degrees of proficiency either. Either you do it, you get it all, or you don't. Conditions, typically for instructors, the condition is on a multiple choice quiz. So probably the most important behavior for academics and health sciences is this behavior aspect of the components. Bloom's taxonomy has been around since the mid-50s. Benjamin Bloom, he divided these educational objectives into three domains: the affective, psychomotor, and cognitive. Affective deals with feelings, emotions. Psychomotor is more kinesthetic and skill-based. And cognitive is the degrees of cognition, or kind of describes the thought processes that go along with them, certain types of activities. So most of the stuff in terms of determining objectives in health sciences primarily is directed in this cognitive domain. The domain, sometimes they're written from the bottom up or the top down, but the structure is basically from less complex to more complex. And the image here, remember, is on the bottom, so it's just your recall type objectives. Then understand, application, and the top level is analyze, create, evaluate. So Bloom's taxonomy has been around since the 50s, when TVs look like this, and not much has changed. They did update Bloom's taxonomy in 2000, 2001, and they added this creating aspect to it. There's a big press for innovation in education, a big press for innovation in healthcare, in a lot of fields. And that's where this creating domain came in, this creating layer of the cognitive domain. So here's an example where it's written from, I guess, the most basic on top, working its way to more complex going down. The important thing here is this is where you get your verbs from, your action verbs. For your learner will be able to, and then you plug in a verb. It's also important to note that these verbs are not necessarily stuck within one of these domains. Select, for an example. You can be selecting from, 4 or 5 choices And it's a relatively straightforward process. If you're selecting something after a vignette or a case, that's a whole different level of cognition. So the verb is important, but it does not tell the whole story. It's very contextual as to what verb you use, what layer of Bloom's taxonomy's cognitive domains you would land on. So for most of us in the healthcare professions and pharmacy school, we're trying to prepare our students for the NAPLEX. We don't live in a true-false world. That's bad form to ask true-false questions. We don't typically live in a short answer world either. And certainly nobody wants to grade essays. We don't typically live in an essay world. So by and large, we live in a multiple choice world, and those assessment instruments dictate what type of verbs we should be pulling out of Bloom's taxonomy to write our objectives with. Question types influence and dictate our objective outcomes, our action verbs. So here's a quick test for you. In terms of objectives, what is better? This list or that list? It'll be like the eye doctor now. Better, worse. Better or worse? How about now? Of course, the trick answer here is, well, at least, if you're going to give me 14, have the courtesy to number them. This is lectures from a single, or these are objectives from a single lecture. And it's the consensus that this is way too many objectives for one lecture. This looks like a before shot of some actual objectives. And if you look at the verbs, describe, distinguish, describe, explain, explain. All right, so the problem here is we're not having a dinner party. We're not having a discussion. We're not going to happy hour to talk about this stuff. Explain, describe. These are too nebulous to translate effectively into learning objectives in a multiple choice setting. So these look like they have not been addressed or edited. These look like they have been. Notice these verbs: recall, discriminate, recognize, identify. I mean, these, you can tell that these have been kind of scrubbed to be to fit in with the multiple choice assessments. These are some other actual learning objectives from a different class, and again, you've got your problematic, discuss, describe, examine, not what we're going to do on the test. The better choices here: recognize, evaluate, apply, identify. So our outcomes, in a multiple choice world, we want to be recalling, identifying, choosing, solving, calculating, applying concepts to clinical scenarios. Again, this is not an exhaustive list, but I'm just trying to direct your attention to best practices in developing learning objectives. Begin with the end in mind. Of course, Stephen Covey wrote a very popular, famous book and made a lot of money with this idea. This same concept, understanding by design, swept through the educational community in the late 90s. We need to know what the result is before we can plan to do it. So, you want to work smart. You want to understand exactly what are your knowledge, skills, and attitudes that will be assessed by your test questions. Then you want to restate those as your objectives, and the learner will be able to terms. So for example, if you have a test question that says which statement is correct, how would we glean a learning objective from that? A student will be able to identify. Another example. Pretend we had a case, refer to the case above. What's the most appropriate therapy at this time? Student will be able to select. So my advice is this: you write your test questions first, and then you extrapolate your learning objectives from those test questions. Couple of things here. When you work kind of from the backwards, the reverse design thing, you reduce the clutter. There's no unnecessary objectives. You know what you're testing on. There's no guessing about, okay, I've got 15 objectives, which ones are going to be tested. So you reduce the amount of objectives that you have. They're completely aligned with your assessment items because they come directly from them. So the rationale here is test questions first and then learning objectives. Why? It guarantees alignment. It guarantees that you focus your attention on what's most important. What's most important to the students, what's on the test. What's most clinically relevant and important should be what you're teaching, should be what you're assessing, should be your learning objectives. And this kind of process promotes continuous improvement, that you're always reassessing, okay, here are my test questions, here's my lecture to support these test questions, here's the learning objectives, how do they match up, how was the performance on these test questions, is it where I wanted them, do I need to do something different in my lecture? So, the School of Pharmacy is making progress. We've included on the peer evaluation form some things that address learning objectives. Are they clearly stated? Are the test questions consistent with the learning objectives? There's also this idea of a test matrix. And what we're talking about here are, what topics are you going to assess on? What level of Bloom's taxonomy will you be assessing on? Are you asking all recall questions or some application questions? What's the mix of those types of questions? What's the optimal mix? There's no exact correct answer to this, but I would think as an educator that you want certain things everybody to know. So you would think those would be very low in their discriminatory power. But there's also things where you want to separate A and B students. You want to challenge students. So there is a lot of good reasons why you want to, at least in your head, consider the idea of a test matrix. How many hard, how many medium, how many easy questions am I asking? This is how we analyze questions. All right, the p-value is how many they got correct. These are, 90% correct and up over here. 10, 20, 30. Okay, so hardly anybody got these right. These are very discriminating questions. All right, 40% got this right, and mid-30s to 40 to 50% discrimination. These are hard questions here. So these are some ways that we can assess our question performance psychometrically. Again, while there's no perfect distribution here, you don't want all your questions over here. You don't want all of them over here. You want a nice kind of a mix here. Now here's some things for sure we can say we do not want. Negative discrimination. Here's 0. These questions need to go away or need to be looked at seriously. I would encourage you to look up this article, An Assessment Model for Multidisciplinary Team-Taught Integrated Pharmacy Courses. Came out last year in AJPE. Great article. Talks about some of the things they're doing in terms of course coordinators getting together, making instructors send in all their objectives, so they want to reduce any type of duplication. And they also allow the students to self-assess after the exam on the learning objectives. So they want to see how the students think they're doing with regard to the learning objectives right after the test. So summary, what we want to do is you want to map out all your learning objectives. So this is a summary of that article. Some of the things they do, in addition, they hold review sessions prior to the exam and after the exam. So this is a pretty robust program that we're we're just kind of starting to look at here at the Bernard J. Dunn School of Pharmacy. All right, so the objectives recap. What is a learning objective? It's the intended result after instruction. What are the components of a learning objective? The ones we're primarily concerned with, of course, it's the ABCD. The behavior is the important one for us because that allows us to pick a Bloom's taxonomy level in the cognitive domain. Is it recall? Is it application? Is it evaluation? And how do we assess the cognitive rigor of an objective? Well, first thing we look at that action verb. Then we ask, what kind of cognition is required to answer this question? Is it a pick 4 or pick 5? Is it a vignette that I have to do some thinking about before I can pick one of the 4 or 5? I mean, ultimately, they're all, select best answer. But depending on your question type, you can make people do pretty serious amount of thinking before they pick the correct answer. And finally, when are you going to write your learning objectives? You're going to write them after you write your assessment questions to guarantee that they're aligned. Thank you very much.